Hi everybody, Mary O'Keefe here from the European Pain Federation EFIC. Today I'm joined by Nancy Lane to give you a teaser of her talk at the 2022 EFIC Congress. So Nancy, thanks very much for agreeing to be interviewed.
Thank you for inviting me. I'm very excited about the conference.
Great. Do you want to start us off by introducing yourself, please?
Sure. I'm Dr. Nancy Lane. I'm a distinguished professor of medicine and rheumatology at the University of California, Davis School of Medicine in Sacramento, California. My expertise is studying degenerative and painful diseases of aging, including osteoarthritis and osteoporosis.
Great. And what will you be talking about at EFIC 2022?
At the conference this year, I'm going to talk about what we have learned about nociceptive pain and osteoarthritis and the biology of inhibitors of nociceptive pain, including nerve growth factor inhibitor and TrkA inhibitors, and the benefits and the challenges that have come up in developing those type of compounds for pain relief. Okay.
And do you want to first start by just explaining some of the challenges, I guess, the type of research you've done to date and what you feel are the main challenges to take this area forward?
Sure. Pain from osteoarthritis, chronic musculoskeletal pain, that's an unmet medical need. So many patients suffer and we have so little for them. Over the past 10 years, there's been a major push to inhibit nerve growth factor, which is one of the main proteins, if you will, that stimulates pain in osteoarthritic patients. And we're going to discuss the development of the inhibitors of nerve growth factor, the results of the studies, the challenges, and what we can do next together with regulatory agencies to try to move these medications into the clinic to help our patients.
Okay. And would you say that they're ready to get to the clinic at the moment?
They've already been. Nerve growth factors inhibitors have been in the clinic for 10 years. However, there's some adverse events that we need to better understand before they're going to be at a point that they're safe and we can get them to the clinic. And I think we're getting close. So we just got to put more effort there. What makes these compounds so special is that one injection of an antibody to nerve growth factor reduces pain 50 to 60% for over 8 weeks. So just think that you could have a medication that for 8 weeks would reduce your knee pain if you have bad osteoarthritis of the knee, give you a pain holiday. We don't have anything like that today with that kind of duration of action and reducing pain and giving patients a better quality of life back. So we really need to work on these agents.
And how do you think they work? Like, why do you think they work better than what we currently have on the market for treatments like osteoarthritis?
Yeah, that's a great question. Why the nerve growth factor inhibitors work better? They're antibodies that you get injected, say, through your skin, and they last a while. It's different than taking a pill that only gives you pain relief for 4 to 6 hours. Because it's an antibody that circulates for a long period of time, you can have pain relief for up to 8 weeks. That's why.
And how long do you think it will take? I guess it's a hard question to answer, but in your estimation, how long do you think it will be to find out more about the benefit to risk ratio of the biologics?
Well, the current biologics that have been studied, there's only one that I'm aware of right now that's in active phase 3 trials, and we're working with that sponsor to get all the information they can to understand the adverse events, so that we're hoping that they can present a package to the FDA and the European agencies that will allow regulators to believe that the safety is okay, so that then the patients can benefit from the efficacy.
Yeah.
It's a work in progress.
Yeah. And what kind of adverse events are you talking about? Would they be, I guess, on the ladder of adverse events, would they be on the more serious or smaller?
Yeah, the major concern is that these antibodies in higher doses cause rapidly progressive osteoarthritis. So somebody who has some osteoarthritis of the knee, there's a number of patients taking these medications that their joints just degenerate such that they need a joint replacement. And we don't exactly know why. So we're studying that.
Okay.
And I'm very optimistic. And in my talk at the conference, I'm going to provide some potential hypotheses to for the etiology of the rapidly progressive OA, and we'll go from there.
Great. Yeah, so it's very exciting that to have an option that delivers the type of pain relief you're talking about.
Yes, and the patient population is so in need of this non-narcotic, long-acting analgesic that we have to push harder for our patients.
Yep. And finally, even though we've spoken a bit about this, if you had to sell your talk in a sentence or two, why do you think people should attend your talk at the Congress?
People can come and learn about the biologics that inhibit pain, the efficacy and the challenges of safety, because we're really in it for our patients.
Great. That's a good way to end. Thanks, Nancy. So for those listening, if you want to join us for our next EFIC Congress in Dublin, Ireland in April 2022 to hear Nancy and from other great speakers, the good news is tickets are now available. So you can get them on the website www.efic-congress.org. Thank you, Nancy, and see you everybody at the conference.
Okay.
Bye.
See everybody there.